Knock knock.
Come in.
Hey, how are you?
Good, how are you?
I'm doing good. My name is Amy. I'm going to be your student nurse for today. I'm going to go ahead and wash my hands and provide privacy. And I'm about to put on my gloves real quick. And do you mind if I see your armband? Could you confirm your name and date of birth for me?
Chase, June 26, 2000.
Okay, and I'm just going to go ahead and I'm going to put my gloves on. And your doctor has ordered that we do a neuro assessment, a head, ears, eyes, nose, and throat assessment. And then I'm also going to do a musculoskeletal assessment and a respiratory and cardiac. Is that okay with you?
Mm-hmm.
All right. So could you just go ahead and tell me what year we're in, if you don't mind?
2021.
Okay, you can tell me who the president is.
Joe Biden.
Okay, could you tell me where you're at?
I'm at the hospital.
Okay, and do you know what part you in?
Just some pain.
Okay, all right. So I'm just gonna go ahead and I'm going to assess your head, if that's all right. I'm just going to lightly palpate it just to see if there's any masses or anything. Okay, there's no masses noted. It's normocephalic and both sides are even as well. And when I was asking you those questions, I was doing the neuro assessment. Do you have any headaches?
No, ma'am.
Okay, do you have any concussions, any recent concussions at all?
No, ma'am.
Okay, so I'm just going to go ahead and I'm just going to look at your ears, if that's okay with you. Okay, and I'm looking to see that the top of your ear is forming a line with the outer corner of your eye. We'll do the same thing on this side. Okay, so I see that there's a line there as well. And do you wear any hearing aids or have any trouble hearing? All right, and I'm just going to get you to cover up one of your ears for me, and I'm going to whisper something in your ear, and I'm going to see if you can tell me what I say, okay? So I'm going to come on this side, okay? A, B, C. Could you tell me what I said?
A, B, C.
Okay, and could you cover up this one? 1, 2, 3.
1, 2, 3.
Okay, good. All right, so that's normal. I see that you don't have any trouble hearing in either one of your ears. I'm just going to observe your eyes now, and I see that your cilia are both white and that your pupils are currently equal. And I'm just going to go ahead and I'm going to measure your pupils with a pen light, if that's okay.
Okay.
Thank you. Look straight ahead for me. Okay, so both of your eyes looks like there are 4. And I'm just going to shine the light in your eye, and this this pupil that I'm going to shine the light in, it should constrict at 50%, and there should be 100% constriction in the other eye. Okay, so we see that there's direct and consensual constriction in both eyes, and same thing for the other eye. And do you wear any contacts or glasses?
No.
Okay, and I'm just going to observe your nose, and I see that your nose midline, and I don't see any nasal flaring or anything. Do you have any history of nosebleeds?
No.
Okay, and next I'm just going to do what we call a patency test. So I'm just going to get you to cover up this nostril for me first, and I want you to tell me what you smell with the other nostril.
Cinnamon.
Okay, then we're going to cover up this one. Same thing over here.
Cinnamon.
All right. And then next I'm just going to go ahead and I'm going to assess your lips and mouth. So I see that your lips are symmetrical and that they're both the same color. And then I'm just going to get you to open your mouth for me, if you don't mind. Okay, and so I'm just looking to make sure that the mucosa is pink and moist, and I'm also noticing that all the teeth are present. And do you wear any dentures?
No, ma'am.
Okay, and oral hygiene is fine for this patient as well. Do you have any issue swallowing?
No.
All right. So next I'm just going to get you to turn around that way for me. Just your neck. I'm sorry.
No.
Okay, and I'm going to come to this side. This way for me. Okay, and I'm just assessing for JVD, and I don't notice JVD. And I'm going to get you to look up, and then look down, and then look this way, and then that way. Did that cause any pain or discomfort?
No.
Okay. So next I'm just going to get you to swallow this cup of water for me, if you don't mind. I'm just going to feel your trachea while you swallow. Okay, so the trachea is midline. Did that cause any difficulty?
No, ma'am.
All right. So next I would also like to note out that your carotid pulses are going to be right here and then over here on this other side. And your axillary pulse is going to be here for this side and over here for the other side. All right. So I'm just going to go ahead and I'm going to begin by listening to your heart and your lungs. Okay, is that all right?
Mm-hmm.
Okay, I'm going to go ahead and listen to your heart first. Okay, and I'm right here at the second intercostal space to the right where the aortic valve is at. Okay, now moving over to the second intercostal space on the left side, which would be where your pulmonic valve is at. Okay, then I'm going to move it down to the third intercostal space at Erb's point. Then moving down to the fourth, which would be the tricuspid valve. And then we're at the fifth intercostal space where the mitral valve is at. Okay. And I heard all normal heart sounds. I don't hear any adventitia sounds. And I'm just going to listen with the diaphragm now for any heart murmurs. And we're, same thing again, we're going to be at the aortic valve over here on the right side at the second intercostal space. Pulmonic valve at the second intercostal space on the left. Erb's point at the third intercostal space on the left. And then we're going to be at the tricuspid valve at the fourth intercostal space. Okay, and then we're at the mitral valve at the fifth intercostal space, or at the apex of the heart. Okay? And I didn't hear any heart murmurs or anything there. And then I'm going to go ahead and I'm just going to listen to your lungs. Is that okay?
Yes, ma'am.
Okay. And I'm just going to get you to take a deep breath with each one of these, okay?
Okay.
Okay, so right here, we're going to be in the right upper lobe. Take a deep breath for me. Okay, and I'm going to move over to the left upper lobe. Take a deep breath. Okay. Then I'm going to move to the left lower lobe. Take a deep breath. Okay, and I'm going to move to the right lower lobe. Take a deep breath. Okay, and I'm just going to go ahead and I'm going to listen to the right middle lobe. Take a deep breath. Okay, then we're moving over to the left lower lobe and take a deep breath. Okay, and I'm going to get you to turn around for me, and I'm going to listen again. And we're going to be in the left upper lobe. Take a deep breath. And then we're going to be in the right upper lobe. Take a deep breath. Okay, we're in the right lower lobe. Take a deep breath. And the left lower lobe. And you can take a deep breath now, please. Okay. And I didn't hear any adventitious sounds in any of those lobes, so I hear everything normal. There's no crackles or rails or anything. And I would also like to educate you on cough and deep breathe first. So with the coronavirus going around, it's important that you're going to take a deep breath, and then you're going to cough, turn cough. Okay, and what that does is it's going to expel any mucus that you have in your lung. If it builds up, it'll help that come out. And I want you to do that 10 times an hour, but don't do it back to back. If you're watching TV, you can do it in between each commercial break. Okay, so how many times an hour are you going to do that for me?
10 times an hour.
Okay, and I'd also like to educate you on your incentive spirometer that you have here. So we're going to kind of do the same thing. You're just going to take a deep breath and hold it as long as you can. And breathe out. Okay, we're going to try to get the little ball. It's going to go up to about 10, okay? So I want you to try that for me. Okay, and we're going to do that how many times an hour?
10 times.
All right, so you can put that over there with your stuff if you don't mind. All right, so next I'm just going to go ahead and I'm going to take your pulses, okay? And do you have any trouble breathing or chest tightness? Okay, it's going to begin by doing your pulse. Okay, so your pulse on this side was a +2, which is normal and expected, and I counted 70 beats per minute, which is within the normal range for your pulse. And then I also was assessing your respirations, and those were about 14 respirations per minute, which is within the normal range as well. And I'm just going to feel your brachial on this side as well, or not your brachial, your radial first. I'm just going to see what it is on this side. Okay, so it's a +2 on this side as well, and then this would be your brachial on this hand, axillary, and then brachial over here and axillary over here. Okay, and next I'm just going to go ahead and I'm going to assess for your capillary refill, and we want it to be under 3 seconds. Same thing for this hand. All right, so that was under 3 seconds, so that's good. And I'm just going to assess for any edema, and let me know if you feel any pain or discomfort, okay? Any pain at all? Okay. Any pain? Okay. And with your respirations, you had even unlabored breathing, which we call eupnea. And next, I'm just going to get you to flex and then extend your elbow. Flexion and extension, okay? And I'm just going to place my hand right here so I can feel while you're doing that, so I can assess your range of motion. Okay, and I'm just going to provide some resistance, so go ahead and push against my arm. Okay, and push against my arm again. All right, good. And I'm going to do the same thing for this other hand. So we're going to do flexion and extension. Okay, I'm going to provide some resistance. Okay, and just push against me. All right, so you have normal strength and movement in both of those. And then I'm just going to do a similar thing for your wrist, which is going to do flexion, extension, and hyperextension, okay? So go ahead and do flexion, extension, and hyperextension for me. Okay, so we're going to do the same thing for this hand over here. Flexion, extension, hyperextension, if you don't mind. Okay, and I don't notice any crepitus or crackling in this wrist or this wrist over here, and I didn't notice any in the elbows either. And then next for this one, we're going to do the same thing, but you're just going to flex and extend without the hyperextension. No hyperextension this time. I'm just going to provide some resistance. Okay, I'm going to go to this side. Same thing for me. Okay, and I don't notice any crepitus or crackling in either one of your wrists. So next I'm just going to go ahead and ask you if you feel any joint pain or discomfort at all. Okay, and I'm going to get you to lay back down for me so that I can do a GI assessment, okay? And I'm just going to be listening to the different quadrants of your abdomen, all right? Do you feel any pain at all today in your abdomen or anything?
No.
Okay. And I'm just going to begin in the right lower quadrant. And we're going to listen for 1 minute, okay?
Okay.
Okay, so now I'm just going to move to listening to the right upper quadrant, okay? And I'm going to listen for a minute again. Okay, and I'm about to move now to the left upper quadrant. and now I'm going to move down to your left lower quadrant, okay? Okay, and next I'm just going to palpate your abdomen, okay? And before I do that, I do notice that your abdomen is flat and it's even. I don't see any visible lumps or anything. Okay, so I'm just going to palpate. And I'm going to start in the right lower quadrant. And I'm just going to lightly palpate here. And we're going to move up into the right upper quadrant, just lightly palpating. Left upper quadrant, lightly palpating as well. And the left lower quadrant. Does that cause any pain? Okay, and I'm going to do the same thing, but I'm not going to do it with like 3 fingers in, okay? And if you feel any pain, and then we're going to be in the right lower quadrant again. And we're in the right upper quadrant. Left upper quadrant. And left lower quadrant. Any pain or discomfort? Okay, and I'm just going to palpate evenly across. Any pain? Okay. And when was your last bowel movement?
Earlier today.
Okay. Do you happen to know around what time that was?
2.
Okay, and are you passing gas?
Not right now.
Not right now. Okay. Alright. So your bowel sounds sound normal. They're not hypoactive or hyperactive, which means they're not under or overactive. So that sounds great, and you said that there was no pain or anything. Okay. So if I can get you to sit up for me again, please. And do you have any constipation?
No.
Alright. And I'd also like to note out that your femoral pulse is here and here on both sides. And then next I'm just going to do flexion extension of your knee, and I'm just going to feel your joint to make sure there is no crepitus or crackling, okay? So go ahead and extend your knee for me and then flex it, okay? And then do it against resistance for me. Okay, same thing over here. Go ahead and flex and extend. Do it one more time, and then I'm going to put my hand right here. Okay, so you have normal strength, and I don't notice any crepitus or crackling in your knees. So next, I'm just going to go ahead and we're going to do a similar thing for your ankle. And before I move down to the ankle, I'd like to point out that your popliteal pulse is behind your knee here and behind the knee over here. And I'm just going to go ahead and we're going to do the flexion extension, and I'm just going to place my hand up here at your ankle, okay? So. Or, my bad, it was plantar flex and dorsiflex since it's the toes that you're doing, okay? Okay. And then same thing over here. Okay. And I'm going to do the same thing against resistance for me. Okay. Over here. Okay. And I don't notice any crepitus or crackling. I'm just going to go ahead. I'm going to assess for edema. I'm going to roll your pants leg up a little bit. Any pain?
No.
Okay. Same thing for this leg. I'm going to just roll it up, okay? Any pain?
No.
Okay, and there's no edema noted in either one of those. I'm just going to assess for capillary refill in your toes. And we want this to be under 3 seconds. And capillary refill is normal under 3 seconds on the left foot and in the right foot as well. Okay, so next I'm just going to see your dorsalis pedis pulse. Okay, I'm going to do it on this other side as well. Okay, and both of those are +2. And I'm just going to do your anterior tibial pulse. Okay, and those are both +2, which are both normal and expected. So, next, and I meant to say this was your post tip, not your anterior tip. I'm sorry. Okay, so next, do you have any trouble, like whenever you're walking, with like falling over or anything? Okay, so what I want you to do is I want you to stand up for me, and I'm just going to get you to walk this way, and I'm just going to assess how you walk. Up. Put your pants way back down. Okay, there we go. Alright, you go ahead and walk this way for me and then walk back. Okay, and the gait is, you don't have any abnormal swaying and you have good balance. So next I'm just going to get you to do a Romberg's test. It's just basic heel to toe walking, okay? And I'm just going to sit right here in case you fall over. Okay, that's good right there. And you can turn back around for me. Okay, and now you have normal balance. I didn't notice any abnormal swaying or anything, and you didn't fall over. I'm going to get you to stand still with your hand at your sides and stand like that for 20 seconds and close your eyes. Okay, you can open your eyes, and I don't notice any abnormal sway. You can sit back down for me. So, you have steady, smooth walking, and there is no swaying, and you have good balance. So, that is good. Let me just make sure that I have everything down that I need for you today. Okay, and I did forget to explain whenever I was doing your neuro assessment what the Gaslow coma scale is. And it's a scale that we use for our coma patients. And it assesses 3 different categories, which is going to include motor response, verbal response, and eye response as well. We just want to make sure that they're alert to all of those. And if your score is less than 8, then that means that you have severe trauma. And if it's anywhere between 13 and 15, it indicates little to no trauma. And so I'm just going to let you know what that was. And that is everything for me today. Do you have any questions or concerns? Okay. I'll write everything down. I'll let your doctor know, okay? Thank you.